In patients who are CDT high, but still have a negative biopsy, there is multiple factors involved that we need to consider with that. One is that perhaps the biopsy did not show the relevant tissue that we needed. With that, I still need to make next steps for that. So if a biopsy is negative and a CDT is high, we need to really start pushing toward other methods of diagnosis. So we start having conversations with our thoracic surgical colleagues, or perhaps an alternative form of biopsy. That's part of that. So it's important to take CDT very seriously with that as well. It's also important to remember that no test is 100%. So we also have to take the clinical context involved with that patient and their history and other disease processes and make sure that we're moving forward on that and not just treating a test, but using that test as part of a strong algorithm for lung nodule workup and management.
Yeah, so patients with CDT high and a negative biopsy, the general approach is very, very close observation, assumingly they've had a PET scan, within that conversation. And I will say with those patients, I'm quicker to go for biopsy. So, the question is my biopsy non-diagnostic, right? Did we do a good job? And so I think for me, if I had that patient come back, we would get a PET scan immediately. And then let's say the PET scan was positive. Obviously, we go back for biopsy, resection, or whatever would be next. If the PET scan came back negative and you had this CDT positive, then it's a close surveillance. And I like the PET scan because it also takes care of other parts of the body. As we know, there can be an overlap in antibodies. So I think you not just exclude the lung, but I'm sure you've heard many cases, bladder cancers and other cancers that kind of pop up on these things. So I think the PET scan for me is if I have a negative biopsy and I don't have a PET scan, the PET scan is next. If I have a PET scan going into this and it's just the nodule and we have a negative biopsy or a non-diagnostic, then I'm either rebiopsying or sending for resection. But I would be aggressive about those. You already have a positive PET in conjunction with that. So this is cancer till we absolutely prove it's not.